Inside your bathroom cabinet right now, there may be 5 common medications silently damaging your heart. A top cardiac surgeon says they're hiding in plain sight, and millions of people over 60 take them every single day without knowing the risks. Today, you'll finally learn what they are and how to protect your heart starting now. After 20 years in the operating room, Dr. Michael Kent says he's seen perfectly healthy hearts break down, not from disease, but from trusted medications. Let's reveal the 5 biggest dangers and the safer options your doctor wants you to know.
Medication number 5, NSAIDs, ibuprofen, naproxen, diclofenac. These are the painkillers almost everyone over 60 keeps in their kitchen drawer. But taking them regularly can be like playing Russian roulette with your heart. Here's why. NSAIDs force your body to hold on to water and salt. That means more fluid in your bloodstream, and your heart has to pump harder every single beat. For seniors, this can quietly raise blood pressure, sometimes enough to cancel out the exact medications you're taking to lower it. And the danger isn't the same for all NSAIDs. High-dose ibuprofen and diclofenac carry the highest risk, especially when taken daily for joint pain or long-term arthritis. So what's safer? Most doctors recommend switching to acetaminophen for everyday aches, or using topical pain creams to soothe joints without stressing your heart. And if NSAIDs are absolutely necessary, stick to the lowest dose for the shortest time possible. After 60, it's not about avoiding pain, it's about choosing pain relief that won't harm your heart.
Medication number 4. One of the most commonly used pills in America and Europe. Proton pump inhibitors, better known as PPIs. Omeprazole, pantoprazole, lansoprazole. You've seen them in every pharmacy, every commercial, every doctor's office. They're sold as harmless stomach protectors, the pill you take daily to stop heartburn, reflux, or gastritis. But here's the hidden truth. PPIs were designed for short-term relief, 2 to 8 weeks. Yet millions of seniors take them every single day for years. Some take them for so long they can't even remember when they started. And long-term use quietly affects the body in ways most people are never told about. The first danger? Magnesium depletion. PPIs block stomach acid, but they also block your ability to absorb magnesium, a mineral that plays a direct role in keeping your heart beating rhythmically. When magnesium levels fall too low, symptoms begin subtly. Fatigue, muscle cramps, irregular heartbeats, pins and needles in your hands or feet. But if ignored, it can escalate into dangerous arrhythmias, some serious enough to require hospitalization. Many seniors think heart palpitations mean anxiety, but often the real culprit is sitting in their medicine cabinet. But magnesium loss is only part of the story. Emerging research suggests that long-term PPI use may stiffen the blood vessels, reduce nitric oxide, the natural chemical that keeps arteries relaxed, and gradually raise the risk of cardiovascular problems. These changes happen slowly, quietly, over months or years. This means seniors who started PPIs for simple reflux may unknowingly be setting themselves up for higher heart risk over time. Now, what should you do? Here's the most important rule. Never stop a PPI suddenly. Your stomach will rebound with a surge of acid even stronger than before. Instead, talk to your doctor about a safer plan. Slowly reduce the dose, week by week. Switch to as-needed use. Consider milder medications like H2 blockers, or use lifestyle changes to reduce reflux naturally. PPIs can be life-saving when used short-term, but long-term, they require careful monitoring, especially after age 60. Your stomach might feel better with a pill, But your heart and blood vessels, they may be paying the price without you ever realizing it.
Medication number 3, the one almost everyone overlooks. A pill you've probably taken dozens of times in your life, thinking it was harmless. Oral decongestants. Pseudoephedrine, phenylephrine, they sit quietly on pharmacy shelves, packaged in bright boxes promising quick relief from a stuffy nose. But inside those tiny pills is something most people, especially seniors, are never warned about. These medications don't simply open your nose. They work by tightening blood vessels all over your body, not just in your sinuses, but in your arms, your legs, your brain, your heart. And when blood vessels constrict, the heart must work harder to push blood through tighter pathways. For a younger body, that's usually manageable. But after age 60, when arteries naturally stiffen and blood pressure tends to rise, this can turn a simple cold medicine into a serious cardiovascular risk. Here's what often happens. Your blood pressure quietly climbs. Your pulse becomes faster, sometimes pounding in the chest. Some people feel jittery, anxious, or lightheaded. Others may feel nothing until an irregular heartbeat begins. Doctors have documented cases where seniors developed dangerous arrhythmias after just a few doses. And for anyone with hypertension, heart disease, enlarged prostate, or thyroid issues, the risks multiply. But the biggest danger? Most people assume these medications are safe because they're sold over the counter. So what's a safer approach? Instead of oral decongestants, experts recommend saline nasal sprays, gentle, safe, and effective. Humidifiers or steam inhalation, especially at night. Topical steroid nasal sprays, which act locally, not throughout the entire body. Or warm compresses to reduce sinus pressure. These solutions help you breathe better without stressing your heart or raising your blood pressure. As we age, even simple cold medicines deserve a second look. Relief shouldn't come at the cost of your heart.
Medication number 2 is something many people assume is outdated, yet it is still quietly prescribed every single day, especially to older adults. Tricyclic antidepressants. Names like amitriptyline, impermine, originally created decades ago to treat depression, but today more commonly given for chronic nerve pain, migraines, or insomnia. And while they can be effective, the problem is this. These medications were designed for a younger, healthier heart, not a heart over 60. Tricyclics don't just affect the brain. They affect the entire nervous system. They block multiple pathways at once, serotonin, norepinephrine, acetylcholine, and this flood of activity can have serious consequences for older adults. Here's what can happen. Your blood pressure can suddenly drop the moment you stand up, leading to dizziness, unsteadiness, even fainting. This alone dramatically increases the risk of falls, one of the biggest dangers for seniors. But the heart effects are even more concerning. Tricyclics can speed up your heartbeat, cause palpitations or fluttering, trigger electrical conduction problems that disrupt the rhythm, and in rare cases, lead to dangerous arrhythmias. Doctors now warn that these drugs can lengthen the heart's electrical cycle, something called the QT interval, which can be risky for aging hearts. And yet, many seniors still receive amitriptyline for neuropathy, back pain, or trouble sleeping, unaware of these risks. So, what are safer options? For nerve pain, doctors may suggest gabapentin or pregabalin, certain modern antidepressants like duloxetine, topical lidocaine patches, or low-dose alternatives with fewer heart effects. For sleep, there are gentler strategies and medicines that don't interfere with heart rhythms. The key point is this.
If you or someone you care about is taking a tricyclic antidepressant, don't stop suddenly. But do ask your doctor about safer alternatives and whether heart monitoring is needed. Your mood and nerve pain matter, but so does your heart.
And finally, number 1. The medication most seniors trust, the one almost everyone believes is harmless, and yet it may quietly increase your heart risks more than any pill on this list. High-dose calcium supplements. For years, people over 60 were told, if you want strong bones, take calcium. It was simple, convincing, and repeated so often that many never questioned it. But here's what almost no one was told. Calcium from supplements does not behave like calcium from food. When you eat calcium-rich foods, dairy, leafy greens, sardines, almonds, your body absorbs the mineral slowly. It's delivered into your bloodstream gradually, in a way your bones can actually use. But a calcium pill, it can release 500 to 1,000 milligrams of calcium all at once, far more than your body can process in a short window. And when your bloodstream becomes flooded with calcium in a matter of minutes, your body is forced to react. It tries to move the calcium somewhere safe, but if your bones don't need it or can't absorb it fast enough, the extra calcium often ends up in the wrong place, your arteries. This is where the danger begins. Calcium deposits can form inside arterial walls, making them harder and less flexible. And stiffer arteries mean higher blood pressure, poorer blood flow, more strain on your heart, and greater long-term cardiovascular risk. Several studies even suggest that calcium supplements may create a sudden spike in blood calcium, something that simply does not happen with food. And these spikes may be linked to an increased risk of heart attacks, especially in older adults. To be clear, scientists still debate how big the risk is. But what's not debated is this. Calcium supplements should never be taken casually, and definitely not without medical guidance. Here's what most people don't know. Your body requires 3 nutrients to move calcium safely into your bones. Vitamin D3 to help absorb it, vitamin K2 to direct it to the bones, magnesium to help regulate where calcium goes. Without this combination, calcium can drift into soft tissues, including your arteries. So, if you've been taking calcium pills because everyone else does, or because a bottle at the pharmacy said it was good for bone strength, please stop and reassess. Calcium from food is safe. Calcium in high-dose pill form, it requires careful monitoring, the right nutrient balance, and medical supervision, especially after age 60. Never start a calcium supplement on your own. Talk to your doctor. And make sure the calcium you take is going exactly where it should, into your bones, not your arteries.
Today, we walked through 5 medications that millions of seniors take every single day, often without realizing that as the years pass, their bodies change and their risks change with them. Anti-inflammatories that once helped you stay active, acid blockers that promised protection, cold medicines that seemed harmless, older antidepressants still prescribed out of habit, and calcium supplements advertised as bone savers. Individually, these medications may not seem dangerous, but for adults over 60, the wrong dose, the wrong combination, or simply taking them longer than intended can quietly strain the heart, the one organ you can never replace. And here's the truth most people never hear. Medications are not permanent. They are not meant to stay the same for your whole life. What was safe at 45 may be risky at 65. What was helpful in the past may be harmful today. This video is not about fear. It is about empowerment. You have more control over your health than you think. The most powerful tool you have isn't a pill, it's an honest conversation. So take a moment this week. Gather every medication you use, prescriptions, vitamins, supplements, everything. Put them in a bag. Bring them to your doctor or pharmacist and ask, do I still need all of these? Is each one still the safest option for my age and my heart? That single conversation can prevent side effects, complications, even hospitalizations. Your heart has carried you through decades of life, through stress, joy, laughter, loss, and every moment in between. It has never taken a break, not for 1 second. So give it something back. Give it your attention. Give it your protection. Give it your willingness to question old habits. Stay informed, stay proactive, and most of all, stay safe. Because the best years of your life still deserve a strong, steady, protected heart.
If this video helped you, share it with someone you love. It could save a life. And subscribe for more science-based health insights.